Good afternoon, everybody. It's great, very good afternoon, and exciting so far. So what I want to be talking about today is brain health and what do we really need to do, where we are and where we need to go to make a difference for mental health for our population. I work at Mayo in the primary care settings with a large team, and the idea is to bring behavioral health to where people are in their primary care. So in the US, how's everything? And I feel a little bit like the waiter here, which is that things are, obviously, there are problems. If you talk to mental health providers, we may feel everything is good, we're helping our patients, but if you talk to primary care or patients themselves or look at the population, there's huge problems. So that 1 in 5 adults in the US have mental illness, 56% of those people get no care whatsoever, and of people who die of suicide, almost all of them have mental health problems. So clearly there are big issues that we need to be able to solve. Now if you look at other areas in medicine like cardiology, there's been huge progress over the last 25 years in terms of number of deaths going down, and it's happened by early intervention with changing in diet, hypertension, dealing with cholesterol, getting people before they get sick, and it's made a huge difference. So is that what's happening in mental health? And the answer is no. If you look at the solid blue line, the number of suicides are going up, up, up. And shockingly, the bars are separated by how far you live from a urban area. The highest is the most rural, the bottom is the most urban. So when you're far from mental health resources, you do much worse. Now this has gone into the public recognition that Kate Spade, Anthony Bourdain, Robin Williams, people know these are people who have everything going for them and they still end up dying from suicide. It makes all of us be worried about ourselves, our families, our kids. What can we do? So the healthcare system, unfortunately, is fragmented, but in mental health, it is really fragmented. You're sort of like these polar bears trying to go along through the icebergs, trying to figure out if you're trying to find for a family member the right mental health provider, it is super challenging to be able to do and very frustrating. Part of that is because the mental health system is siloed. So you have primary care, addiction, community mental health, social service, and the different groups don't talk to each other. So if you're a patient, you go one place, then you go to the second one, they don't know you, they haven't heard you, have to tell the whole story all over again. So the chances are that most people give up before they get there. So what are we going to do? Well, hopefully this is not what you think we should do. The ostrich might think things are good, but it's not. And so we need to be able to do something, and the good news is that we actually know what we need to do now to be able to make a big difference in this. And Don Berwick, who was the head administrator for a while and is at IHI now, said trying harder will not work, changing systems of care will. And I'm preaching to the choir here, that we need to change the system. Getting people to stay longer at work is not going to be the solution to this, that we need to fundamentally change things. The people in rural areas, we're not going to get the mental health providers there at all. So at Mayo, we have, over the last year, set up a system of bringing a team and weaving them into the primary care setting at all of the main primary care clinics in Rochester, and have found dramatically better outcomes in terms of the whole triple aim. So it's possible to be able to do it, but it's all on-site in the clinic. And the question is, what about in rural clinics? So we've got clinics that are in way western Minnesota, northern Minnesota, in northern Wisconsin, and there are no mental health providers. So a lot of them will have 1 or 2, 3 providers. It's not possible. But as you've been hearing through the whole conference, everywhere, this is from a friend of mine, Madhukar Trivedi, who's a psychiatrist from India, that everybody has access to cell phones, and you see here with a lawnmower, but he's on his cell phone. And so that it not only for rural areas in the US, but if you look around the world, there's a huge potential to be able to get resources to people. The sad thing is that what's happened so far is that in the virtual world, you can do these things remotely, but we've created the same silos virtually. We have virtual care coordination, virtual psychiatry, virtual social work. And that isn't going to work. So what we're trying to do is think of ways to connect these silos together with virtual teams. And the team provides care for people that are in rural or distant areas. And the team doesn't even have to be physically in the same place. They can be in different places, but they've got to be communicating and working together with the patient's primary care team to get them better. Now, if you go to mayoclinic.org, you can see that the beginning of this exists, and you can get information for mental health on screening, diagnosis, treatments, some information on referral, but it's not connected to the rest of what you would need to get better, to get evidence-based treatment. What we're working on is this model, which you don't need to look at the details, but in the pink around the outside is the virtual integrated behavioral health team that is then connected to the inner technology with the internet and then with the outside primary care team to pull this together so that you can do this for patients anywhere they are, regardless of whether there's providers there or not. So now this could be people in the room, it could be family, it could be your kids. It's really disturbing that every 12 minutes someone in the US dies of suicide. So in the time for my talk and the one before, somebody dies. So while we're trying to think about this and figure it out, bad things are happening. Now this is a slide from Don Berwick, which is of a bridge that's in Honduras that was designed to survive hurricanes. And it did survive the hurricane. And there was a major hurricane, and you can see the bridge is still there. The only problem is the river moved. And that's where we are with mental health. We've got a system where we have this very nice thing that isn't where the patients are. So if you agree that this is a problem and you'd like to join me in terms of thinking about solutions, please email me at katzelnick.david@mayo.edu. Thank you very much.
David, how are you? Thank you so much. I just was interested to get your take. I don't know if you were here yesterday for the session.
Yes.
Tom Insel was talking
Yes.
about the apps, and I was interested about even measuring how you type, right? The
Yes.
patterns of how you type. Just what that could actually be a signal for something. Things like that. What did you make of what?
Oh, I think that there's a huge potential for that. That being able to get the sort of digital fingerprint of people really makes sense. There's actually data that his group and other groups have done that if patients let you just look at your cell phone and you just, without even looking at the content, when people got up, when they went to sleep, how often how many people they interacted with, how far they went, you can actually get information on whether they're depressed, whether they're getting better, whether they're getting worse, without them inputting anything. So it's actually, and with voice recognition patterns, you can do a very good job in terms of understanding people's mental state and tracking it just by their voice. And I think that you have a sense of that already, that if you have kids, you pick up the phone within like 10 seconds, you have an idea of how they're doing before they say anything. Just from their voice, you can know that if you know them. So I think there's huge potential to be able to do this without it interrupting the care and being able to do it. I've got all my patients now that I try as much as possible every day they get a thing where it says, what's your mood? And then they just text message that back, and they can email me how their mood is. And so it's very possible.
The key, though, is then to integrate it like you were doing with the
silos. Yes, it's got to be integrated, and you've got to bring the silos together.
Thanks so much.
Great.
David Katzelnick, thank you so much.